It's time for Checkup with Dr. G.
Time for a checkup with Dr. G, Dr. Michael Garver with Premier Care Pediatrics. And speaking of checkups, mental health checkups are important for children.
I think one of the things, Art, that you're focusing on is taking care of the entire child. And sometimes mental health issues are either ignored, they're looked over, and then sometimes people come in specifically for mental health issues with their child. And
what are some of the triggers that you see?
Well, this is a multifactorial process, sure, which we've talked about before, and some of the things related to obesity or bullying or stressors in the home, single-parent families. And there are a lot of problems that children struggle with because just in society in general, there's a lot of stress that translates into the child.
I hear some parents talk to their friends about food allergies cause some types of symptoms in children, and they get treated for the wrong thing when they find out they actually had some sort of allergic, like to sugar or to wheat or gluten or whatever. Is this something that you see?
Well, there's a lot of alternative treatments for mental health issues, and a lot of those have not really been proven scientifically. And so we're very open, I am, to what parents do and the way they want to treat their child. But if they come to me for advice, then basically we go through what some of the choices are that they have.
And you have brought this as part of the holistic care of the child here. Because of your independent status as a pediatrician in this community. Well,
we can do what we want to do. And there was a mini fellowship that's at the Mayo Clinic, and I've been chosen to go there and actually spend some time honing my skills in pediatric mental health to bring that back to Great Falls, to expand the services that are available here in the community. And I think that that's the focus of Premier Care Pediatrics and what we do here, and that's what we do best.
And I think one of the things that you notice when you come in is there's two separate areas in your waiting room. One is for the child that is obviously sick, and the other one's here just to have a checkup.
Well, that and also the availability 24/7, where the phones flip over to my cell phone, where parents can call me so that they don't, so they can get some reassurance, or that they don't have to worry the entire weekend when I'm not available, or have to go to an urgent care center. The other thing that we do here is that we stay open late, so the parents don't have to get off of work, and they can come here for both healthy children and also sick visits.
So you also have a nurse practitioner on staff too.
That's right, and that's made expanding the hours possible.
Okay, so the rumor is that they can get a hold of you pretty much just about any time, day and night, and holidays, and that's got to be a great relief for parents, and sometimes it only just takes a phone call, right?
That's correct, and it's not a rumor, it's actually operating, and it's a very effective system, and I don't get as many calls as what people really expect, and people have really taken to this, the availability issue.
And that's today's Checkup with Dr. G.
You've been watching Checkup with Dr. G.
Premier Care Pediatrics, where your family comes first.